how professional is the setup there? Or are there concerns about sterility and all these other things?
Now, the setup, the theatre tent is sacrosanct. Unless you've got business to go in that theatre tent, you simply do not go in that theatre tent. So we had business to be in there, and so we did. Now, the wards are different. Yes, they're sacrosanct, but more people will go on the wards because clearly the wounds have got dressings on, and so the chances of getting contaminated and infected are much, much lower. And indeed, one of the strong points of this particular facility was that every morning at 6:30 a.m., the whole hospital would do a ward round. And so you would go round, and you as the surgeon would present the cases that you'd done the previous day to your colleagues. They would ask you questions, and by golly, if you couldn't answer them, then you really ought to have a reason for not answering them. And so that was really good for the patients. And so if, for example, a patient had a fever of unknown etiology, unknown cause, and you thought it might be due to your surgery, one of the physicians would pipe up and say, had you thought of malaria, or had you thought of leptospirosis, and so on. So it's quite good to have a debate, and the patients would benefit as a result.
Okay. Are you learning things in those scenarios?
Of course you're learning things.
Okay.
You're teaching and you're learning. And you have so many specialties there. Yes, you have orthopedic surgeons, you have vascular surgeons, you have general surgeons, you've got plastic surgeons, you've got physicians. And so on that basis, you're teaching each other the things you need to know.
Those first 24 hours, how many surgeries did you perform?
I think that first day, I think we got through 21, which is quite a lot for one operating room. It probably doesn't sound very many.
No, it sounds like a lot.
But it sounds. If I tell you that when I'm really working hard in the UK, if I do 6 in a day, I'm doing well. So we're doing 21. That's a lot. Now, one of the problems, of course, of doing 21 is because you're not necessarily closing all those wounds the first time round, they go back to the ward, they then come back again. And so day in, day out, gradually the numbers you are doing are increasing because not only are you getting new casualties in, but you're also treating the old ones. And so your wards start to get fuller and so on. So there's a logistic issue. So the aim is to get patients out as soon as you possibly can.
Did you have anyone die on you when you're there?
Sadly, we did. Yeah, we did. It's a problem. People see a hospital. Okay, it's a tented hospital. They see a lot of well-trained doctors, and they want their advice. But often they seek their advice too late. And some people are unsalvageable. You do your best for them, but you don't always win.
And that's because infection set in, or they're just too much bleeding, or just something from a wound.
Well, there are different causes, really. But generally, if you bleed a lot, then even if you bleed slowly, if you bleed rapidly, you die from blood loss, of course, don't you? But if you bleed slowly, you can still bleed, you can still die because you start to lose the ability to fight infection, and so you can just generally be overcome and overwhelmed. And so clearly we would like to get people as early after injury as we possibly can. But if we're seeing them a week or 7 or 8 days because the logistics, communications are so bad, it gets very hard to treat them. And then in addition to that, every operation you do is another surgical stress on that patient. And I can remember one young child, he's about 5, and he'd actually had a corrugated iron injury. He'd sustained a below-knee amputation on one leg. It's a terrible thing to see that in a 5-year-old, and a major nerve damage on the other leg. And his blood count must have been down in his boots, and literally the blood was like water. You normally expect blood to be slightly treacly and thick. I'm used to that. This was really thin and really like water, and you knew this child was going to find it very difficult to either survive, or he was going to find it very, very difficult to heal. Now, as I left him, when we left, at the end of the day, he was still doing okay. But you worry about it. Every single operation is another assault on this poor individual.